Thank you for joining us. I'm Richard Peritz, and our show today will focus on health. It's become more clear than ever that everything is interconnected. For example, even dental problems can lead to life-threatening inflammations. Our guests today are Dr. Jeff Ganeles, one of the top implant specialists in the United States and the creator of the revolutionary Teeth Today procedure. He is internationally recognized as a leader in the field of implant dentistry with patients from all over the world. And joining us also is Dr. Stephen Joyal, MD. Dr. Joyal is the Chief Medical Officer for Life Extension, which is the world's leading organization totally dedicated to research and treating the diseases of aging and identifying life-saving therapies. He's also a featured speaker at medical conferences worldwide, and we are very privileged to have him with us today, both of them, to share their perspectives following these messages. With us now are Dr. Stephen Joyal and Dr. Jeff Ganeles. It's a pleasure to have you both on the same show. This is really
Thank you.
A real great opportunity. I'd like to start with you, Dr. Joyal. We live in a world where there are so many concerns regarding health, environmental concerns, questions about what the pharmaceutical industry is really doing and so forth. Those who treat symptoms and those who really believe that it's more sensible and responsible to even consider the causes. Tell us a little bit about how you see this picture in general.
Well, the question you're asking, I think, is very important, and the issue cuts really at the core of conventional medicine. Conventional medicine is really focused on treating disease, not so much focused on prevention. So you go to see a physician, and I'm conventionally trained. I'm an MD. I went to Brown University, got my MD back in 1993, a long time ago, which my wife reminds me about all the time. Nevertheless, my training as an internal medicine physician was on people coming in, having a variety of different health concerns, health problems, but it was a disease treatment model. Now, what Life Extension does is we really approach individuals from a more holistic or integrative position. And what I mean by that is we're really aimed at helping people live healthy. We'd like to try to prevent a number of problems that occur over time. We know one of the biggest problems we see in society today is obesity. And obesity increases one risk for metabolic disease, type 2 diabetes in particular, as well as cardiovascular illness. So using that as an example, our real focus is looking at people and trying to help them not only lose weight, but improve a variety of different cardiometabolic parameters, which is another reason why we believe so passionately in periodic blood testing to identify problems really before they manifest as a heart attack or a stroke.
This is most interesting, and of course, I'd like to ask you, Dr. Ganeles, for your view on preventative medicine.
Well, I'm a periodontist, which is one of the branches of dentistry, and I'm conventionally trained as a dentist and a periodontist as well. When I came into practice, which was a bit earlier than you, I must admit, you're the only person here without gray hair, but we were focused on disease management too. Our diseases were primarily dental diseases, which primarily are decay, and periodontal disease, which is inflammation of the gums that causes bone loss and tooth loss. And there's been kind of a explosion of information from medicine and also from dentistry that points to some of the common denominators of many of our diseases, which is inflammation. Inflammation is very related to obesity. Inflammation is one of the primary problems of metabolic disease. And inflammation is caused or is one of the products of periodontal disease, which is really my specialty. A recent paper just came out from NIH that points out that almost 50% of adults over age 30 have some degree of periodontal disease. That's almost 65 million people in the United States have periodontal disease, which is a cause of inflammation. So we're talking a little bit about the different sides of the same coin here. That inflammation that originates in the mouth causes lots of damage, tooth loss, suffering, and other problems, but it also can cause metabolic disease, cardiovascular disease, maybe it's involved with Alzheimer's, maybe it's involved with some other chronic inflammatory diseases. But we're really starting to see some bridging of the fields of medicine and dentistry in this area. All of the dots haven't been connected yet, but clearly there is enough evidence and enough molecular biology and understanding of molecular medicine to start putting all this information together. And we in dentistry have many answers for the problems of periodontal disease. We can pretty much arrest it, we can regenerate bone, we can replace teeth, we can really get rid of it. And by and large, we've been more or less ignored in the world of practice and care in the United States. There are only about 10,000 periodontists in the U.S., and we have 65 million people to take care of, and that is clearly impossible. General dentists also take care of some degree of periodontal disease, but there's still a tremendous amount that hasn't been addressed. And that's a big risk factor for our health and our well-being.
I'm very interested to hear what you had to say about inflammation, and I agree completely. Inflammation is really at the root cause of so many diseases, certainly cardiometabolic disease. You're well aware of the data linking periodontal disease to an increased risk of heart attack and stroke. It's interesting to me because there have been a number of studies that have been done that have looked at various pathogens, oral pathogens, seeing if they're in atherosclerotic plaque, and there's data to suggest they were. One study comes to mind, Prove It. There was a component of that study that looked at a medication called gatafloxacin, which is a quinolone antibiotic. The bottom line was that the results were not what we had hoped to see. Nevertheless, it does raise another issue, which is it may not be the pathogen per se, it may actually be this underlying inflammation. And we know that inflammation, and I agree completely, is one of the components of cardiovascular disease. And one of the things that we measure at life extension is CRP, C-reactive protein. And it's amazing to me because, certainly in my time in practice, I've seen a number of patients, specifically younger patients under the age of 50, presenting with a heart attack or even stroke, unfortunately. And almost always, they also had an element of periodontal disease. It may have just have been bad gingivitis, or they may have had full-blown, periodontal disease. So very interesting, I agree.
Yeah, there's some interesting studies, and unfortunately we don't have the conclusive information to say, we don't have the aha moment yet. But there's clearly an association between pregnant women that have severe gingivitis, that have low birth weight babies or premature births and complications from pregnancy. Again, the reason probably isn't the bacteria itself, it's a reaction to the bacteria. There have been studies that have isolated oral bacteria in atherosclerotic plaques. But again, I think that may be perhaps more of a coincidence than the actual problem itself. When I began my career in periodontics, really, which was in the early 80s, we were looking for bugs. We were looking for specific bacteria to find out what it is. The pendulum has now swung over to looking for the reaction to those bugs. We do know that if you have a severe dental infection, your CRP goes up. We know that if you have severe periodontal disease, it becomes more difficult to manage your diabetes.
Absolutely.
We know that if you bring it down, it becomes easier to manage your diabetes. There's some interesting studies that show that people who lose their teeth, I forgot exactly where it is, but if you lose your teeth at, say, age 70, your chances of your mortality rate doubles in the next 7 years compared to someone who still has their teeth. Now, we don't know whether if you suddenly replace those teeth with dental implants or some kind of fixed restoration, whether that brings it back down. That study hasn't been done yet. But clearly the quality of life is improved if you have your teeth or fixed tooth replacements in the world of implant dentistry. And that's really where I also spend an awful lot of my time, sort of simplifying those procedures and making them more readily available to people at lower cost and faster. We call it Teeth Today because in reality we actually can take someone who has a mouthful of failing teeth or no teeth and give them fixed teeth in one day. So it's teeth today. And it is remarkable technology. It takes advantage of advances in diagnostics, advances in implant technology, advances in how we do the surgical procedures, how we create teeth. And it's improving and evolving very rapidly. Whether that's going to make a big impact on cardiovascular disease or some of the chronic diseases in our world, I'm not sure. But I can tell you for sure that the patients that go through this live better afterwards. They have better nutrition, their weight is reduced, which is certainly better for obesity because their diets improve, and they feel more self-confident, they have better outlooks, and we know that just self-image and ability to speak and interact and socialize and everything that makes us human, as that gets better, your health improves. So all of those things are really where we're at and what we're doing in dentistry today.
This is really most interesting, and I'd like to ask you, Dr. Joyal, what are your thoughts with regard to the use of fluoride and so forth? I know that life extension is in the forefront of research in many different areas. What are your thoughts on that?
Well, I'm not a dentist, but I can comment on fluoride. I'm very data-driven. Our organization's data-driven. There's a great deal of information out there showing that the use of fluoride does reduce the risk of dental caries. I'm also aware that there are some loud voices in the, shall we say, alternative medical community that have identified some issues with fluoride, but I'll defer to my colleague who is an actual dentist.
The data that comes, that you can review on the use of fluoride in water supply is that it is probably one of the most successful public health measures ever instituted in the communities that use it. Dental caries is a huge problem, and for areas that have instituted fluoridated water, decay in kids has almost dropped to zero in many places. And frankly, if there were no decay, if there were never any fillings, it would reduce the amount of future treatment and retreatment and periodontal disease and crowns and bridges and everything else that's done in the world. So if you never get that first dental decay, you will stop the domino effect of requiring more and more dentistry and more expensive and invasive procedures. I also know that in areas that have been fluoridated, absenteeism goes down in work, absenteeism in school for kids goes down, days lost for other reasons goes down, and this is all measurable. There have been anecdotal reports or complaints that fluoride potentially could be a carcinogen, but they have never been substantiated. So there are certainly people that object to being forced to have certain, I call it supplements, to be forced to ingest a supplement. I suppose they could get bottled water where there is no fluoride, but for the public and for public policy, it's been a great, successful implementation. And frankly, dentistry is one of the few professions that tried to put themselves out of business by fluoridating the water. So there's nothing in it for the medical or dental world to do that.
In your practice, you see people coming from all over the world, and they witness a kind of science fiction setting where you have the latest equipment. It's just really quite astonishing. What does the future hold in your area?
We have been evolving for a long time with technology and with techniques and with materials and understanding biological implications of what we do. So essentially, what we do today is we can replace teeth virtually instantly. And we can do it in a minimally invasive approach, meaning that there is very little pain, very little swelling, very small surgical techniques to accomplish that, and we can do it very predictably. In the future, we'll be doing it slightly better. We'll be doing it slightly faster. We may be doing it slightly less expensively because all of the materials and methods that we use are becoming more efficient or more predictable. And essentially, we can treat almost any kind of dental problem that involves tooth loss or deterioration of teeth very efficiently and quickly and comfortably for patients.
Dr. Joyal, how do you see the challenges in your area?
That's a pretty open-ended question.
Quite.
We have a variety of challenges. I think one is something that we discussed very briefly at the beginning of the segment, which is really a paradigm shift from a disease-based model to more of a prevention model. And that presents a number of significant economic challenges within an environment such that we can't keep mortgaging our future, our children's future, and this has much broader implications politically, culturally. Our population is getting older. We have a baby boomer generation which is really healthier than past generations, wants to maintain that health throughout their lifespan. And so that's why we believe that prevention is going to be so important. We talked a little bit too at the beginning of the segment about the power of integrative techniques and treatments. That is blending the best, it's really translational medicine in many ways, blending the best so-called conventional treatments, that includes pharmaceutical options, with whether it's nutrition, lifestyle, behavioral choices. But that paradigm shift is going to be very challenging. One reason is, despite disseminating good information, at the end of the day, what we really need to start doing is building a partnership with our patients, meaning that it's not just going to the doctor and writing a script for a prescription and sending that patient on his or her way. It's really forming a partnership for care, building a strategy for optimal care throughout someone's life. That's a major challenge. And then, of course, the other side of this are the economics of this. There was a recent study that came out that, and of course we would disagree with this, and I'll give a good example of this, which is that in many cases preventative services are expensive. And there have been health economic studies that have looked at this in depth. Nevertheless, if it happens to you, then that's a very expensive lack of preventative service. So we've got to figure out the economics of this, and this is really much bigger than even life extension. What we're really aiming to do is really change that paradigm. But our society, our culture has to want to do that, and somebody's going to have to pay for it as well. And then, as I said, it's really about forming a partnership. The patient needs to be active in his or her care. That patient needs to want to exercise, eat a healthy diet, do a number of lifestyle and behavioral modifications. If they're not doing that, they're eating a typical American diet, they're not exercising, then the chances are that their health will be adversely impacted. And that's why we, as I said, we really need to build this partnership.
Gentlemen, this is so very interesting. Unfortunately, we have to pause for these commercial messages. We'll be right back. We're back with Dr. Stephen Joyal and Dr. Jeff Ganeles. Gentlemen, I'd like to ask you a question with regard to, well, I'll begin with you, Dr. Ganeles. How do individuals know if they are in a situation in which they may have dangerous inflammations? What are the solutions?
Well, I think it's a really good question because a lot of patients sort of expect their gums to bleed when they brush their teeth or if they floss, when they floss. And the reality is that no bleeding of your gums is normal. And you really should check with your dentist, make sure you have a dentist and that you see that dentist. 50% of Americans don't have a dentist. So the first step would be to get one and have a good cleaning, have some x-rays done to check on your bone levels, see if they're good, and make sure you ask the questions, why are my gums bleeding? And just because is not a good answer. Sometimes if gum disease or periodontal disease advances, teeth may get loose, you may have bad breath, you can actually see pus coming from the gums, and that sounds disgusting, but it happens, and people are not aware of it. So it doesn't hurt, and that's really what many people wait for. But my teeth are fine, they don't hurt. Well, that's not sensitive enough. You've got a problem. You've got bone loss, you've got inflammation, you've got periodontal disease, and you're probably raising your systemic levels of inflammatory mediators.
And it's life-threatening, actually, isn't it?
It's all cumulative. So if your inflammatory mediators are increased, if your C-reactive protein is up, then it does start putting you at risk for cardiovascular events. And then if you have other risk factors, you may be heading towards heart attack or other cardiovascular disease, and you may be ruining your teeth too. So if your gums bleed, if your teeth are loose, if you're missing teeth, if you have bad breath, see your dentist. If your dentist doesn't give you the right answer, ask to be referred to a periodontist. If he says you don't need a periodontist, and a periodontist is the specialty involved in specifically treating gum problems in dentistry, then seek a periodontist on your own. The American Academy of Periodontics has a wonderful website which is great for people in general, and it's called perio.org, perio.org. And there's a very startling statistic on the front page of that, and it says that 47.4% of Americans have periodontal disease. That's shocking. We are in a civilized country that has one of the best health care systems in the world. We should not have half of our adult population walking around with moderate to severe periodontal disease, and we do. So people really should take responsibility for their own care. If they're not getting the right answers from their dentist, then take matters into your own hand and make sure that you seek out the proper opinions yourself, because you really need to take care of that for your teeth and for your general health.
And what I'd like to add to that is that it's a very relatively cost-effective, simple way of assessing our level of systemic inflammation in the body. And we can do that by measuring something called CRP, which stands for C-reactive protein. We know that inflammation in our blood vessels contributes to an increased risk of stroke and heart attack. In addition to CRP, there is another test of vascular inflammation that we've looked at, and it looks like it's going to be very promising and more specific, and that's something called the plaque test, which measures lipoprotein PLA2. So again, we think of inflammation, it's not just local, it's systemic, and we know that inflammation is linked to cardiometabolic disease, and an easy, cost-effective way of assessing our level of vascular inflammation is CRP.
I can only imagine how miserable the world would be a couple of 100 years ago if there weren't people like you here today making things so much more comfortable, painless, and promising. Thank you so very much for being with us. Thank you, sir. This brings us to the end of our special show for today. I'm Richard Peritz. Thank you for being with us.